and the closed captions button. And introduce our guest speakers. So Jordan Banick is a seasoned professional and community organizer with a strong background in outreach, project management, and strategic partnerships. She received her BA of Political Science and Communications at the University of Washington and an MBA from URI. She is also the co-founder and was co-director of the Women's Project. She currently works as the Outreach and Communications Manager at HealthSource RI, and today she will guide you through the various options available to you and help you make informed decisions about your health care. She'll be joined by Kristen Areson of our HSRI Employers team, also known as SHOP. Kristen has been with HSRI for 5.5 years. She first served as a sales director and is now the assistant director for employers. Without further ado, I will pass it on to Jordan.
Thank you so much, Robin, and thank you for having me. I'm going to start it off and then I'll turn it over to Kristen. So I do outreach and communications for HSRI, and I focus mostly on the individual and family side. So when we conceived of this presentation, we thought about a small nonprofit would consider both what individual and families could qualify for health coverage and what you might be able to qualify as an employer. So we kind of brought our two pieces together to pull this conversation. So we're going to go first. I wanted to just explain a little bit about what HealthSource Rhode Island is. HealthSource RI is Rhode Island's official marketplace for health coverage. It's the place we can connect eligible Rhode Islanders to health plans that meet their needs and budget. And we are the only place that you can qualify for assistance to lower your monthly premium costs. In fact, 6 out of 7 of our customers receive financial help. Additionally, if you qualify for Medicaid, we can also mostly help you sign up for Medicaid coverage. And we also have HSRI for employers, which connects small businesses and nonprofits with comprehensive benefits package. So that's just a little summary of HealthSource RI. And here's our agenda. So I'm going to go over HealthSource RI coverage for individuals and families, health coverage and policy overview, the Rhode Island health coverage landscape, health coverage affordability options, how we engage in the community. And then Kristen is going to cover the next things. I can let you go over that if you'd like.
Sure. So I will start off by introducing myself and then talking about the benefits of HSRI for employers, who we are, how long we have been working with Rhode Island employers, and how the coverage that we have, the options that we have. We have a full choice option. We also provide ancillary benefits that small businesses are able to offer their employees, as well as, what is one of the biggest reasons why we have small businesses work with us. It's to attract and retain talent. We want to bring top talent to the state of Rhode Island, and we also want to retain them as well. We have some client testimonials, from some familiar faces that small businesses in Rhode Island that we have insured over the last decade or so. So I will turn it back over to Jordan to get started. I know we have a full agenda.
Thank you. So we just wanted to start here with just an overview of the health coverage and where people get health coverage, just to kind of have a baseline of understanding. There's a mix of private coverage, which is often employer-based coverage you might get through your employer, but it's also the direct purchase coverage, which you would get through an insurance company or through a plan that you purchase through HSRI. Then there's the public coverage options, which are Medicare, Medicaid, and TRICARE in the VA programs. So that's how the coverage landscape breaks down. There's also a couple of other coverage considerations that we just wanted to mention in here. One is COBRA. So that allows someone who is leaving their employment for some reason to purchase coverage through their employer at 102% of the cost of their premium. Which can be a way to fill in the gap of coverage, but often HSRI is more affordable because you might qualify for a tax credit. So we just like to mention that when people go through job changes or transitions, that HSRI might be an option. The other one is something a rule change that the federal government made in 2023. which is a test, is your employer coverage affordable? So in some cases, an individual might be offered employer coverage. And in the past, that meant that they could not purchase coverage on the exchange. But now they can determine whether or not their employer coverage is affordable or whether it would be more affordable to cover part of their family through the exchange. And so that can be an opportunity for employers to think about how they're helping their employees navigate this, like what coverage options you might have and how they might pull together affordable coverage, maybe what an employer offers to cover the individual, and then the individual then purchases a plan on the exchange and receives a tax credit. So I just wanted to highlight that. So the ACA is the Affordable Care Act, and that is what created the health exchange. That it was passed in 2010 and signed into law. The ACA offered an opportunity to fill in a lot of the coverage gaps. It established the exchange, which is HealthSource. We opened our doors in 2013. The other thing it did is expanded Medicaid. It allowed states to expand Medicaid. So Rhode Island is one of the 41 states, including the District of Columbia, that expanded Medicaid. And it also created a baseline of individual benefits. So we'll watch this little video. What?
You have to share the audio.
Sorry, I'm checking if folks on the call, were you able to hear the audio of the video or no? Okay, one.
All right. Might just skip that.
Apologies.
So the benefits of the Affordable Care Act, to kind of summarize it, were that it created a tax system where customers could receive subsidies to help lower their monthly premium costs. Those are the advanced premium tax credits. It also established federal standards for minimum essential coverage on marketplace plans. These are things like preventative care, like mammograms and colonoscopies, maternal care, and more. It expanded eligibility for Medicaid, as I mentioned, in the 41 states in the District of Columbia. And it also created the no wrong door policy, which is what I mentioned. If you call HealthSource RI and are Medicaid eligible, they can often help you. It did establish a federal mandate for health coverage that was overruled by the Supreme Court, but Rhode Island implemented a mandate for coverage. So everyone in Rhode Island is required to have health coverage or pay a tax penalty. When can you get health coverage? So we have an open enrollment period, which is November 1st to January 31st. This is a time when anyone can sign up for coverage, regardless of their qualifying life events. Outside of the open enrollment, we have what's called a special enrollment. So this is a life qualifying event that will trigger the ability to enroll in coverage. This could be something like losing your employer coverage, turning 26, getting married. And also, as I mentioned earlier, is your employer coverage affordable is a SEP or a special enrollment. So you can enroll at that time if that's the case. So in Rhode Island, where do people get their coverage? Well, most people still get 51% get them from the employer, 22% from Medicaid, 15% from Medicare, and we have 8%, which is the non-group exchange. So that's the folks that we serve. And we're really lucky in Rhode Island that we have been able to increase the rate of insured. And right now we have an uninsured rate of about 3%. So just like diving a little deeper into that, where we are with enrollment in Rhode Island, We have about 315,000 folks who get their coverage through Medicaid and 43,510 who are enrolled in coverage through HealthSource. So that's our highest level of enrollment since we were founded in 2013. We've had a few changes that have expanded access to coverage for people. One of the things that I wanted to highlight is Cover All Kids expanded Medicaid coverage in Rhode Island to all kids up to age 19, regardless of their documentation status. And that also applies to pregnant people. You can qualify for coverage. And pregnancy is a special enrollment period. So if you are pregnant, you likely qualify for coverage. Additionally, there is a new federal regulation that'll go into effect on November 1st, which will allow lawfully present folks with DACA status to be eligible to purchase coverage on the exchange. So just to kind of summarize what coverage through HealthSource RI can mean is you can qualify for financial assistance. Plans to suit different needs and budgets. We have a variety of level of plans that they offer for different coverages, but there is a safety net of the essential benefits that were created by the ACA. So there is a baseline of preventative coverage that's provided. There's coverage for mental health visits, and plans include pediatric dental. Wanted to highlight that there's something called a cost sharing reduction plan. So in addition to the federal tax credit that we've mentioned, there are plans for folks at certain income levels that reduce your total out-of-pocket cost based on the percent that you pay. So the silver 94% here limits your cost to 6% of your income. So it's just important to think about what the spectrum of coverage options might be, and that maybe between Medicaid eligibility and purchasing a plan on the exchange, there is an additional option for coverage, which would be a cost sharing reduction plan. And we can share these slides at the end if anyone wants them, because there's a lot of numbers on here, and if you find that useful, we can certainly get it out to you. And I want to just dive a little bit deeper into the advanced premium tax credits. So these tax credits are paid monthly to you to reduce your monthly premium cost, and then they're reconciled at the end of the year when you file your taxes. So one thing when we talk to folks about them is it's really important to keep an estimate of what your annual income is going to be. So at the end of the year, you don't end up with a tax surprise, either too much or too little, right? To keep it where your income is at for the year. And the other thing about how financial assistance is calculated is it's based on your family income and size, but not based on your family assets. So some other programs do ask for asset verification, but that's not the case with the APTC. And just a little bit about our team here at HealthSource. We do the outreach for the communications team, but we think a lot about people who might not be insured right now, and where we might be able to reach folks who are in that 3% of folks who don't have health coverage, to let them know. We can see that that's often in non-native English speakers, people of color, lower income communities. And then we also do map certain zip codes with higher rates of uninsured to help us figure out how to outreach to the community. And how we connect with our community, we have a street team. We have a monthly outreach partnership meeting. We have an advisory board. We do community organization outreach and literature drops, tabling, event sponsorship, a quarterly community newsletter, interagency collaboration, and presentations and workshops. And we've been participating in the Health Equity Zones community learning events. And across our network, we have 14 languages that are spoken that we can work with people in. And this is just a little information about how you could enroll in coverage. So there's a navigator network, which provides one-on-one assistance, and you can make an appointment with them. We also have a certified application counselor, and sometimes folks are at local community organizations and they have someone on their staff who is trained to assist with signing you up for coverage. We have our call center. And also, I know this is a United Way event, so 211 you can call and they can help you enroll in coverage. If you're looking to get support with Medicare coverage, you can call the point for that. Here's just a little bit more information about enrollment coverage. And with that, I can turn it over to Kristen.
Great, thank you so much. I do not have access to change the slides, so I'm just going to have to ask that, is that Jordan or Yvonne that has the slides?
I got it. I'll take care of it.
Okay, great. All right, so we can get started with who is HSRI for employers. So the next slide, please. All right, who is HSRI for employers? We're Rhode Island's health coverage marketplace for small employers. We have been around, again, for over a decade. We insure approximately 20% of the small businesses in the state of Rhode Island, almost 1,200 small businesses, and we cover over 8,200 lives. Our success is possible through the work with brokers, with the broker community throughout Rhode Island. So we work with small businesses, nonprofits that have brokers or businesses that are non-brokered. So we work with businesses as small as 1 employee up to 50 employees. So that is what is defined as a small business. It is 1 to 50 employees, full-time employees in the state of Rhode Island. Next slide. What are the benefits of HSRI for employers? So what do we offer the small businesses of Rhode Island that the individual carriers don't offer? So we offer no minimum enrollment requirements. Again, that's that minimum of 1 unrelated employee to the business owner. We offer a combination of plans from multiple insurance companies. Currently, we have Blue Cross Blue Shield as well as neighborhood. So we have 19 different plans from the two largest health insurance carriers that we offer on the shop plans. The business owner receives 1 consolidated bill. So that means that we're able to come in and work with your employees. They're able to pick out of the 19 different plans, and the business owner or the nonprofit owner is able to just write 1 check per month, and all of their employees are covered. So what that is called is it's a full choice option. We also provide a defined contribution. So what that does is that allows the business owner or the nonprofit owner to decide an amount of money that you're able to contribute for the health insurance needs of your employees. So you're able to control your costs. So you're able to work with a fixed cost over the year to help control in the cost of the business. We have a business engagement team that works locally. They are Rhode Island based. They're based out of Fromford, and they are able to work with the employers as well as employees every step of the way. We call it our concierge service, and we do pride ourselves on our 97% renewal rate that we have with our groups, because we're able to meet the needs of all of the employers as well as the employees. Next slide. I might need music for the slide changes too. All right, so how we talked about the full choice, but how does the full choice for employers work? It's a blend of predictable costs with flexible options. So when we talked earlier about attracting and retaining employees, we know that when an employee comes for an interview, the second most important thing that they ask after salary is health benefits. So with this, you're able to provide your employees the choice of 19 different plans instead of being required. If you're working with an individual carrier, your employees must pick from 1 of 3 plans, and that is called mini choice. So here at HSRI, we provide full choice. The employer decides how much they want to spend. The employees pick from the multiple health insurance companies. They pay the difference between, the employee pays the difference between what the employer has chosen to contribute, and then the employer writes 1 check to HSRI for employers. So again, we're trying to make it simple. We're trying to streamline and make it easy for Rhode Island small businesses and nonprofits to be able to provide health insurance to their employees, because we know that healthcare is a very complex business, and we're trying to make it as easy as possible for our Rhode Island businesses. Next slide. Alrighty, this is just an example of the full choice of how it works. So if you decide that you're going to contribute X amount of dollars per month or per family for your employee can either choose to pick up a plan. So if you decide to offer provide $400 to $500 a month. If your employee decides that they want to pick a plan for them and their family, that is $1,400 a month. If they decide that they need a premium platinum plan that has more robust coverage, they're able to do that. They would contribute a little bit more. If your employer decides that they are a healthy individual that only goes to the doctor for all of those things that Jordan just spoke about that are already covered under the Affordable Care Act, your mammogram, your annual physical, your annual blood work, and you may choose to buy down coverage, which means that your coverage would just be less expensive. Or if your employee is already covering the full amount, then you may not owe any money when it comes to the end of the day in your paycheck. And all of this, again, the employee gets to choose. So the employee is happy, which comes back to our retention on employees, and the employer writes one check to HealthSource. Next slide, Jordan. In addition to health and dental, we also offer ancillary benefits. These are the list of ancillary benefits that we do offer: HSRI, vision, life, accidental, medical bridge, pet insurance. We know our pets are important, so pet insurance is important too, as well as critical illness, and debt counseling. So these are just some additional ancillary benefits that we do offer to help you offer a more comprehensive benefit package to your employees. Next slide. Attracting and retaining top talent. This is, I hope that we'll be able to hear from, these are just a couple testimonials from some of our clients. These are the owners of Bayberry down in Providence. So hopefully we can hear this.
I'm Natalie Denon.
I'm Tom Denon. We own Bayberry Beer Hall and Bayberry Garden. We've been working with HealthSource RI for our employees for 2 years now.
Working with HealthSource RI for employers made it really easy for us to understand the whole process.
They walked all our employees through the individual choices that were available that would fit their budget best and get the coverage that they need.
Working with HealthSource RI for employers allowed us to focus on what we do best, running our restaurant.
The process was incredibly seamless.
They were great.
Hi, my name is Lucas Lowney, President, Coastline Electric Inc.
Joshua Puglia, Vice President, Coastline Electric.
My name is Ben. I am a third-year apprentice. Well, I like to be healthy. For me to do that, I need health insurance.
HealthSource RI for employers sat down with all the employees and helped us with the transition to the new healthcare.
We went over the different plans and chose a plan that best suited me.
I would definitely recommend HealthSource RI for employers.
Working with HealthSource RI was easy and convenient.
Hi, my name is Lucas Lowney.
Great. There's a couple other, which we don't have commercials, but some nonprofits that we've done in some of our recent campaigns. Some familiar names would be the Sojourner House, House of Hope. We have just done some, they're a group of ours as well, but we didn't have a commercial for them, but we do have some of them on some of our marketing pieces. So we try to work with the nonprofit world as much as possible, because we are able to provide such cost savings and options that are able to help the nonprofit world. So the next steps here, I had put my name in the chat, but this is my contact information. And again, I'm the Assistant Director for HSRI for Employers. So if there are any questions, I am happy to answer them. We write new businesses every month of the year. Typically, if you are currently offering health insurance to your businesses, then you'll have a month that your insurance will renew. So that would probably be the best time to switch over if you're interested in learning. But if anyone is even just interested in having us run a quote or anything like that, we're happy to do that and happy to have the business engagement team sit with you all and take the time to just let you understand, you know, how we can make this process a little bit easier for you. We'll turn it back to Jordan if there's no questions.
Yeah. Robin, were there any questions?
I just got one. Are there tax breaks or premium reductions for small nonprofits?
There are. So with coming on to HSRI for employers, you are, and we always tell you to work with your tax professional, but it is based on the average salary of the employees. So you can receive tax credits up to 50%. But that is all based on the size of your nonprofit. It is all based on the full-time employee, your FTEs, as well as the average salary. And for 2023, don't quote me because they haven't done 2024s yet for taxes, was less than 60,000. So that is something that we are working on trying to raise because we feel that it's important for the tax credits for small businesses that are coming onto HSRI. So you are eligible for those tax credits for the first 2 years that you work with HSRI.
So just to clarify, you're saying if the salary is less than 60?
It would be the average salary. So what they do, it's a yes, it's an equation. So I want to just always just preface it with talk to your, because we can't give any sort of tax or legal advice. So the equation comes down to the average salary. If it is not a nonprofit, they do remove the business owner. So I'm not sure in a nonprofit if they remove the director or anything like that. So I would just have your tax professional look at that. But you are eligible for the first 2 years. So you are eligible to even receive partial, even if it's not the full credit. Any other questions?
I recently got a quote for an employee who has a family with a spouse and 2 teenage children, and the rates were pretty comparable to what we were finding in other places in a plan we already had, which was fine. But I also I'm curious if we were missing anything.
So
there didn't seem to be much difference.
Okay, so the health insurance rates are the health insurance rates. So if you are in the small business pool and you are a 27-year-old, the rates are going to be the rates for every 27-year-old across all health insurance. So where it becomes beneficial to work with HSRI for employers is that you're able to offer that 27-year-old one of 19 plans, the 50-year-old one of 19 plans. So that way they're all not locked into the same plan. Because you don't ever want to lock a 20.
You can differentiate for the employees.
I'm sorry.
You can differentiate for the employees based
the
on
employees
their
can have the
performance.
choice, and you can choose what percentage you want to contribute.
I just have a question as well. I'm just trying to understand like the broader landscape of health insurance, and my question is just not knowing or understanding the difference between working with HealthSource Rhode Island and a broker. Is that a broker only going to give you a couple options and HealthSource gives you up to 19? Could you just kind of talk about the differences between those two methodologies?
Sure. So when working with a broker, the broker can choose to shop your small, I shouldn't say shop, but they can look around and they can quote you with different health insurance companies. when working with HSRI, and we work with brokers. So brokers are paid by the insurance company, and what they're paid is already put into the rates. So there's no cost savings by not working with a broker, because they're even if you're not working with a broker, the rates are still the same, which is that's I guess a different Zoom meeting, and I don't know how much time we have for that, but so the broker can choose to shop you with a whole bunch of different health insurance carriers, United, Tufts, Blue Cross Direct. The only way for your small business employees to get a neighborhood health plan, though, is for them to be able to come through SHOP, to come through HSRI for employers. We have exclusive access to be able to provide their plans to small businesses, and truly they're a cost effective alternative to the other plans, because it's a Rhode Island based plan. So if you have an employee who doesn't look outside of Rhode Island for their healthcare needs, it's a great alternative for your employee to be able to save money, if, say, the business owner needs a more complex plan and doesn't want to offer that to everybody. You can also tier how much you contribute, so that's a little bit different. You can that we can do with HSRI. So if you are a nonprofit or a small business, and at the director level, if you want to contribute 80% to your directors, and if you want to contribute 65 or 50% to your staff, and if you want to use that as a way that you can work in promotions and bonuses and things like that, where you're able to contribute more. It is a cost-effective way to be able to do that, because it allows you to contribute a little bit more to someone's health insurance, which is, we know, a large expense for families, especially in Rhode Island. Our rates are high.
Thank you, appreciate that.
I'm whining with the best that they are insuring my family of 4. My husband owned a small business, and we've been on both sides of it. And I am a customer personally of SHOP. So not only am I employed, but I'm also me and my family receives our health insurance from SHOP.
I have a question, but it's more about on the individual side of it. Is that all right?
Sure.
Okay. I actually have a 2-part question. The first one is that I noticed that you keep saying that you're eligible for the tax credit for 2 years. I currently get my insurance. I work for an organization where there's only 1 full-time employee. That would be me. And so I get my health insurance through HealthSource RI. We don't offer it through our organization. And so the first question, I do currently get a partial tax credit. And so you're saying that, I'm not sure if it's just the employer side of things, that after 2 years, you no longer are eligible for that tax credit, or should I be, will I have a rude awakening soon? Or
no, so my conversation was strictly for the business owners. So the first 2 years, so you, but I will let Jordan speak to the individual and family side.
Yeah, so there isn't a limit on the amount of time you can claim the tax credit. I will highlight with the Inflation Reduction Act and the American Rescue Plan Act, the amount of the tax credit was increased. So there used to be a maximum at, it was based on 400% of FPL. So if your income was if your health coverage was more than 10% of your income up to an income of 400% of the federal poverty level, that would be your maximum tax credit amount based on that income. The American Rescue Plan Act and the Inflation Reduction Act reduced the maximum amount of income. So it just became a test of income. And then it reduced it to about 8% or so of income. So those tax credits actually continue through 2025, but Congress will need to extend them beyond that. Otherwise, it'll revert to the 400% and 10% that it was prior to that legislation.
Okay.
So it's interesting that you said 2 years, because they won't expire, but there is a chance that Congress may not extend them, but I know they've been really helpful in people affording coverage.
Yes. Oh, definitely, without a doubt. That kind of leads into my second question, which is that while I'm not offered insurance here, and I'm not sure if any other organizations are in a similar boat, Good Neighbors does offer me a stipend towards my health insurance, or if like, yeah, it's really meant towards that. But if I wanted to, let's say, put it away into other benefits, it's like a benefit stipend. But we found, especially recently, when I got the stipend, it increased my income and therefore decreased my tax credit. And so we've kind of been looking at different ways in which to not have like the taxes, like that type of stipend, be taxed in order to pay for insurance. I'm not sure if I'm making much sense because it's really
You are like,
So-
I totally hear what you're saying. I'm not
Mhm.
a tax professional and how you
Okay.
figure out that, but I do think there's probably, some clever ways. I mean, and maybe if your employer is not going to cover the full cost of your coverage, maybe
Mhm.
there are other health benefits that they could provide and just pay for. Because I think the difference here is that when they give you the stipend, it counts into your income versus if they were
Exactly.
paying a portion of your premium, they would, your income would not increase based on what they were paying in the premium. I'm not sure if Kristen has anything different to add from her perspective.
I do not know.
Is there a minimum amount of individuals under an employer's plan?
The minimum participation is 1.
Oh, okay. All right. Well,
There
excellent.
you are, right?
Yeah, exactly. Thank you.
And honestly, so we have almost 1,200 small businesses, and 25% of them are businesses of 1.
Oh, interesting. Okay.
We are very heavy on small business in the state of Rhode Island. And about a third of our businesses we've had since 2014. Oh, 2014. It would be
And
higher, I
actually,
think, if it wasn't for COVID, but
Kristen, I don't know. I mean, could you run the numbers for her if her employer ended up taking what they're contributing as her income and then like a plan of 1, right? If she could convince her employer to do it, to do the coverage instead. I don't know how much the stipend is and if that's worth it.
No, it's a great idea because I looked into this before, but I was told that there had to be at least 2 people, even if that second person just got dental coverage or something, but we just don't have that second, person that would need that dental coverage. So
are you a nonprofit or are you a business owner?
we're a nonprofit.
Okay, and you're not, okay, so no, you only need 1 person. If you are,
Oh, that's fantastic.
the only way you would need a second person is if you had, if you were a business owner, so you need to have
So
one
maybe that was
non-related employee, that's on the insurance, even if they take dental. But no, we can absolutely get you in touch with the
Awesome,
business
great.
engagement team. And they can, you can compare the numbers that you have from the individual side, and we can show you the numbers and the different plans, because keep in mind the plans on the individual side and the employer side do not mirror each other. So
Okay.
you may be on a plan, but again, we have we have 12 plans from Blue Cross and 7 from neighborhood. So there's going to be something that you're going to find that, and we have health insurance plans are based on metal levels. So they, you have your bronze all the way up to your platinum.
Excellent. It sounds like it's definitely worth it, so I'll be in touch for sure.
All right, I have a couple of questions from the chat, and feel free to pop in if it's your question and say if it's already been answered or if it's changed since hearing these answers. But the one I have now is, could you please provide more information about the credit? My previous employer enrolled me through HSRI and I benefited from the credit. However, at the end of the year, I had to pay extra for some reason when I entered what was paid. My first question is the 2-year eligibility still valid now that I'm working full-time at my nonprofit as a director? I chose not to use the credit this time because I was worried I have to pay the gap during the tax season. Is it still possible for me to switch, or are there other options available?
I think that question was a little, I feel bad. I think was confusing about me talking about the 2 years for the business owners and the nonprofit. So that does not apply to the individual. So Jordan would have to speak on the tax credits and what is available on the individual side.
Yeah, the tax credit is just going to be based on your income, and as the person wrote, if your income is different than what you estimated, you could end up owing at the end of the year because your income was greater than what you had estimated. And I would assume that when you file your taxes there, you can take your credit, because there isn't, if you have the credit available to you based on your income, if you've had coverage, it would just be a matter of at what income you had at the end of the year.
All right, the next question I had in the chat is a company's premium based on the employee's healthcare utilization? For example, an employee with a chronic health condition with expensive meds, does that impact the employer's cost for health insurance?
No, it does not. In the small business market, so there are different types of plans that we do not offer at HSRI for employers, but those are different type of plans that they are looking at your health history and usage. No, when we are quoting, all we need is date of birth. And we even tell employers, you can just put somebody's first name, last initial. We're not looking at anybody's health history, anybody's pharmacy usage, or anything like that. There are different types of plans that do that. They're called self-funded or self-insured. That is not something that we offer. We strictly use the small business rates for the small business plans, which go by are age-based. They're not even differentiated by male or female.
All right, and the last question I have in the chat is, does the ED of the nonprofit count for an employee of one?
Yes. If the executive director is the only employee that they're looking to insure, or the only employee that is full-time, absolutely. Not a problem. Was that you, Kate?
No, it was Deb. I'm not
Okay.
driving anymore, and I am the only employee, ED, etc., for my organization. But I too was under the impression that in order for the nonprofit to be able to offer me insurance, that we needed to have 2 employees.
No, no, you are able to be we again insure groups as small as one, or with just one employee that needs health insurance, or one employee that requires health insurance.
Okay. And there was another person on the call who said that they receive a stipend that can be utilized towards the cost of their health insurance. I don't know if it's within the scope of this call, but I think last week we were speaking about the new Department of Labor minimum salary requirements. And I was wondering if that kind of stipend towards health insurance would count towards the minimum salary amount.
Hi, so it probably, it definitely from the IRS perspective counts like as part of my salary. So I would say
Got
yes.
it. Okay, thank you.
Yeah.
And those are all the questions I have in the chat so far. All right, not to rush anyone, but I will make sure that all the participants who registered for today's webinar get Jordan and Kristen's contact information. And Jordan will be able to get the slides for this as well.
Yeah, I can send them over to you.
Awesome. So in case anyone has questions after this, there'll be channels to reach out as well.
Thank you so much.
Thank you for having us.
Thank you for your time.
All right. Thank you, everyone.
All right. Bye.